Hi, I'm Dr. Katia Batista, psychiatrist. Welcome back to the mini series on borderline personality disorder. In this second chapter, we will dive into one of the core symptoms of borderline personality disorder, emotional dysregulation. But if you haven't watched chapter 1, I encourage you to do that first to better understand the foundation of this disorder. Emotional dysregulation refers to difficulty in managing emotional responses. People living with borderline personality disorder often experience emotions that they are intense, rapidly shifting and difficult to control. It's not just about feeling too much. It's about the inability to return to a stable emotional baseline after something triggered them. This instability is not voluntary, it's a neurological and psychological response shaped by a combination of genetics, environment, and brain function. In daily life, we say, don't take it personally, but for someone with this condition, everything, when I say is everything, feels personal. That phrase does not apply easily here. For someone with this disorder, even if small changes in tone, attentions, or presence are felt intensively. Emotional dysregulation, just to understand and summarize this part, involves a triad. A triad, like the first one, is elevated emotional sensitivity. Like I said, emotions are triggered easily. The second one, intense emotional responses. Reactions are more severe than the situation requires. And the last one, a slow return to emotional baseline. It takes longer to calm down after an emotional event. This triad creates a cycle where minor events can lead to significant emotional distress. Neuroscientific studies have shown that individuals with borderline personality disorder often exhibit hyperactivity in the amygdala. The amygdala is the brain's emotional processing center. This hyperactivity means that the stimuli are perceived as more threatening, leading to exaggerated responses. I cannot continue explaining about borderline personality disorder without explaining you the attachment theory connection. Attachment theory connection suggests that the early relationships with caregiver shape our ability to regulate emotions. Many people living with borderline personality disorder have history of insecure or disorganized attachment, leading to difficulties in managing emotions and relationships in adulthood. Let me put the emotional dysregulation in different contexts. In romantic settings, for example, emotional dysregulation can manifest as fear of abandonment. There is constant worry that the partner will leave, idealization and evaluation, swimming between viewing the partner as perfect and worthless. There are intense reactions to perceive slights. A delayed text even might be seen as rejection. A partner that forgets to say good morning, just simple things, lead to feeling of being unloved and can trigger an argument. At work, challenges include difficulty handling criticism. Feedback is taken personally. Interpersonal conflicts, misinterpreting colleagues' actions as hostile, impulsivity, even quitting jobs impulsively after minor arguments. A supervisor's neutral feedback is perceived as a personal attack, leading to emotional outbursts. Friendships and social interactions are also affected. Like I said, the fear of rejection is common. Constant need to reassure. Overreacting to minor issues. Difficulty trusting. Past experience make forming new friendships challenging. For example, not being invited to a casual meeting leads to feeling of exclusion, and the person could end the friendship. As a psychiatrist, I want to emphasize that emotional dysregulation in borderline personality disorder is treatable. There are scientifically supported interventions that can significantly improve emotional stability and quality of life. The first one is dialectical behavior therapy, DBT. DBT is the gold standard for treating people with this condition. It combines elements of cognitive behavioral therapy with mindfulness. DBT teaches 4 core skill sets: emotional regulation, learning to manage intense emotions; distress tolerance, surviving emotional crisis without harmful behavior; interpersonal effectiveness, building healthier relationships; and the last one is mindfulness, staying present and reducing reactivity. Many patients report improved emotional contrast and fewer self-destructive behavior after completing a structured DBT program. Other practice is mindfulness, often integrated within DBT. This helps patients become aware of emotional triggers without immediately reacting. Practices such as breathing exercise, grounding techniques, and non-judgmental observation of thoughts can help reduce emotional intensity and increase self-regulation. And the last one is the medication. While there is no medication specifically for this condition, pharmacotherapy can target specific symptoms like the mood instability or depression. SSRIs is the selective serotonin reuptake inhibitors like sertraline, fluoxetine. They can help to improve these symptoms. Also, for aggression and impulsivity, we used to prescribe mood stabilizer like lamotrigine, sodium valproate, carbamazepine, and when there are psychotics-like symptoms, we can prescribe quetiapine, aripiprazole. But it's very important to note that medication must be prescribed and monitored by a psychiatrist. Self-medication is dangerous and can worsen symptoms. Just to summarize, emotional dysregulation in borderline personality disorder is a complex interplay of biological, psychological, and social factors. By increasing awareness and understanding, we can foster empathy and support for those affected. This channel is a safe place where science meets compassion to help you understand and care for your mental health. If you found this video insightful, please like, share, and subscribe for more content about mental health. Thank you.